Hello and welcome back to the Talk No One Talks About. I am your host, Faye, and here we'll be having very open conversations about all the uncomfortable topics no one else talks about. Before you ask, I will not be doing this alone. I'll always have here with me people with lived personal experiences and or professionals. So today, I have two very exciting people with me. Hello.
Hi. Okay, so my name is Dr. Ngozi and Dr.
Welcome.
So I'm glad to be here and to be speaking today. Like you said, those topics no one want to ever talk about. So I'm glad I want to speak about them today.
Right. Thank you.
Hi everyone, my name is Dr. Edith. I'm happy to be here, really. They are really interesting conversations and I think it's something we should talk about as health professionals.
Great. I'm really excited to have you here with me. I mean, how often do we get to sit around with doctors talking sexual health, personal hygiene, STIs and all of that?
You know, right?
Yeah, so let's start with something I'd say exciting. A lot of people consider pretty irritating. I mean, there's a lot of negative and positive and just mixed feelings around this particular topic, right? As far as sex goes, I'm talking period sex. Let's talk about period sex from the professional and medical personnel point of view. What are your opinions about having sex during periods?
Okay, I think menstrual sex is pretty safe, if you ask me. It's generally safe, but there are things to consider, really. There are pros and there are cons. Now, on the in quotes advantage of having sex during menses is the fact that the menstrual fluid serves as a lubricant. Already the place is wet down there, so you don't have to be overstimulated, to release the fluids for penetration. And then the other thing there is that there's that because you're menstruating, there's a reduced risk of being pregnant. So, but on the other hand, you have to consider the fact that it may be messy, because the whole blood and all that, which I think Dr. Ngozi is going to add more flavor to what I'm saying now. Yeah. And then the fact that it can cause discomfort and cramps, if you do have sex during your menses. And then I think the other thing is the fact that, there's that increased risk of infection. There is something we call PID, pelvic inflammatory disease, where is an ascending infection of the female genital tract. And so when a lady indulges in sex during her menses, that area is already shedding, and then any little infection will easily get transmitted up to the uterus and of course fallopian tubes. And then the other thing is, I think, of course, the menstrual fluid itself can transmit whatever sexual infection the person has. So whether the person has HIV, syphilis, hepatitis B, whatever, can be transmitted during sex. So those are the things to really consider when having sex during your menses. But I kind of think it's wild, and a lot of people get to try it out. Really, I've heard a lot of people talk about having sex during their menstrual fluids. Though I think that's where the personal hygiene and then sexual hygiene will come in. Things to do to keep you safe while you're doing that, while you're having sex. So I think that's it.
Well, that's really enlightening. That's really, really enlightening. So you said something about discomfort. I'm sorry. We'll talk about you. I just did not want to miss this. You said something about discomfort and cramps. Yes. Because there is a myth that when you have sex on your period, the orgasm eases the cramps. So that's not true.
Exactly. I've heard a lot of those stories. In fact, those are the things that young men usually used to, make a young girl, to want to have sex early, telling her that, these are menstrual cramps. By the time I just go in, you're going to be free of them. But sorry, it's not true. So I'm sorry to burst any young person's bubble out there. It's not true. In fact, there are studies to show that it actually increases discomfort and cramps because of the release of some chemicals in semen.
Okay.
Yes.
Okay, Doctor.
Ngozi. Okay, thank you, Dr. Edith. Sexual intercourse during periods, for me, is a personal thing, is a choice. Some persons like to explore. Some persons like to explore. For them, they tell you that, oh, even if you've not had sex this way, that means you haven't even started. So for them, one of the things and one of the areas to also explore is having sex during periods. So for you and for your partner, is for both of you to actually agree, what do you want? What do we want? But is it safe? Yes. Then are we now saying that, okay, because it's, then you have to consider the messy aspect of it. I know that Dr. Edith also spoke a little about that. You consider the messy aspect of it. What's going to happen? Is this going to be happening on the bed? Is he on the floor? But because most people who also engage in this are crazy set of people who want to explore in so many areas. So it's just for you to be probably, once you're able to talk about it mentally, psychologically, you're prepared for it. And then you know that, oh, okay, maybe after this, you're going to be having some messy areas, some messy bed sheets and all of that, which you need to clean up and wash off. But again, there's this aspect of it that, okay, like, if you want to have sex during menstrual period, and you also need to be careful, there's a way you will plan it. You may not even have to even deal with blood. You understand? First thing I like to say that, okay, maybe because of personal experience too, I'll say, okay, I want to have my bath. And then when having a bath have a way of making you wash off very well. And then if you wash off very well, and then you now engage in sexual acts, maybe it could even take a whole of that time, probably during ejaculation. That's when probably your partner could now see that, could ask you, oh, babe, you're menstruating, that kind of a thing. Because you had already done the initial hygiene aspects that would have made the whole place not to be that messy. You understand? So that's where you can still have your sex and enjoy it. And then, but you know that while you're enjoying it, because you must have it, also bear in mind about some of the disadvantages aspects that Dr. Edith had talked about. And again, in the past too, we've had situations whereby young people, especially because they want to go meet with a certain guy and they go take some kind of medications that could inhibit their period. It has already started, but because they know they need to make that move, they just want to stop it for like 2-3 days. And I'm here saying that's too wrong. There is time for everything. Your body is already programmed. Your body is a system that works on its own. It's programmed that by so day of the month, this will happen. Don't stop it, please. Don't try to stop it. Allow it to flow. You can still have your sex while you are flowing. Just keep yourself clean, do what you want to do, but please do not inhibit it from coming out. That's really exciting and educating. So I have two questions. Questions from like what you've just said. You mentioned like having your baths, and you know, sometimes the period might not necessarily come out like before and during sex in itself. So there's another myth that when you get turned on, when you are wet, the blood does not necessarily flow so much. Does that have any medical backing? So you know that I don't think it has any medical backing. That's our bodies function in different ways.
Exactly.
There are some persons that even with taking their bath, once they just come out, you will see some persons that when they are in their period, they will finish having their bath as they are coming in. The way they will rush their sanitary towel. There are some persons that may come out and they even forget that they are even in their period. They may even sit down and start gisting with you. Probably when they are about dressing up, they will say, oh, my period. That's why they will not remember to rush for their sanitary towel. You understand? So that just goes to show that there are different ways our bodies function. So that particular one is actually a myth that has no basis in science. It doesn't happen that way. It's just about you, maybe because the way your body functions. Yes.
I totally agree with her. I think that may be someone's personal experience that they have generalized. You know, that's the thing with myths and misconception. It happens to one person, and then maybe or not, a story just and then it goes round and round.
That's so true. That's really so true. So you said something about not stopping your periods, like not doing it intentionally, especially when the period is already there. Just to be clear, that's not like saying, oh, don't take contraceptions, right?
So the aspect of the contraception is different. You're taking contraception because just like she talked about that, the fact that you're even on your period will make you not to get pregnant. So that's not even contraception. What they are doing is that what they are taking
for the purpose of sex.
Exactly.
Okay.
Just to stop the period from flowing.
Yes.
Yeah.
Okay. So there are certain people who the periods just flow, just stops sometimes.
Okay.
Right? You mentioned how the body is programmed and how the body works, right? So I'm assuming, given what you've just taught me, that when your period just does that thing, it's something you should look at. It's something that should be looked into. So there are certain people, speaking for myself, because we're here to learn. There are certain people who maybe I'm on my period and then I take a drug or a medicine. Let's say I have a headache and then my period just stops.
Okay.
So during my periods, I absolutely cannot treat anything. If I'm having malaria, if I'm having typhoid, I'll just rather malaria kills me, right? Wow. Because if I take paracetamol, if I take anything,
it will just stop.
My period just stops, and I notice that it stops because I'm on the very heavy side, right? Okay. So you know that there's a difference. You know that this is not normal. So is that something serious?
So the thing is that for you, that's actually a peculiar case with you. Just like we're saying again, it's not something to generalize.
Okay.
People have different ways they react to certain drugs. And the good thing is that in your case, you did not set out to purposely take that medication because you want to inhibit your period from continuation.
Yeah.
You took it because there was
a discomfort.
Exactly. You were ill, or there's a condition that needed that you needed to take medication for, which you now took and it stopped. So I wouldn't even, like you said, I would rather let malaria kill me than let my period stop. Please don't. Malaria will not kill you. Please take your medication. If your doctor places you on malaria medication, please take it. If the period stops, it is not the same as to somebody who set out purposely to stop their period.
Okay.
You understand? So yours will not have any effect because for the fact that you took probably that malaria medication and it stops it has another way that is already addressed in your system, which is not dangerous, which is not a bad thing.
Okay.
Exactly.
Okay, thank you very much. So
I think I should just add that I think your case is really peculiar and something one should investigate more. Because we know, medically speaking, that is only maybe hormonal drugs, that can affect and alter one's menses. But basic drugs like anti-malarials shouldn't exactly. So I think it's something that you should investigate more, and then we as medical persons should also investigate and find out, okay, so does this mean that this can happen when someone takes anti-malarials? So I think it's something we can take back home.
Okay, thank you. Now taking the spotlight away from me.
Yeah, sure.
You mentioned something. You mentioned a window period, like during your period, your body's vulnerable. There's what did you say? Shedding.
Okay, shedding.
There's shedding inside your uterus. Yes, and there's all of the menstrual business going on there. So it makes you very accessible and prone to infections. Yes. So what are these infections that lesbians can have, like during engaging in period sex?
Okay.
So not just lesbians.
Not just lesbians. Please, because I think anyone can contract any STI as far as it's a sexually transmitted infection, and you're indulging in sex. Anyone can contract it. So me, I should mention them now.
Yeah,
so we have HIV, the human immunodeficiency virus. We have hepatitis B. We have syphilis. We have I think hepatitis B and C too. So there are a lot actually, and then other sexually transmitted infections can be bacterial vaginosis. Yes. Okay, now that's for maybe lesbians that maybe share toys that were not properly sterilized. They can contract vaginosis from that. Yeah, so that's
okay.
And
there are
then
lots, really. There are lots.
The human papilloma virus is also there. It's
the
also
what?
The human papilloma virus. That's HPV. It's also common among lesbians, or everybody can also contract it. But the thing is that what is most important is that we talk about prevention in sex. So it's expected that even with or without periods, people should use protection.
Thank you.
There's a reason condom is there.
Exactly.
Male condom is there, female condom is there. So people should explore to make sure that there's always protection during sexual intercourse. It is very, very important, because one way it keeps your mind at peace. And that's why sometimes you hear us talk about dual protection of condoms. And some people begin to think that when you talk about dual protection, you're talking about people actually wearing maybe 2 or 3 condoms at once for a particular sexual act, which is not true. But when we talk about dual protection of what condom does, is that condom will save you from contacting any of the STIs that she has already mentioned. There are a whole list of them. The HIV is there, the syphilis is there, gonorrhea is there, HPV is there, a whole lot of that is there. So, but with condom, you're sure that it will save you from there. It also saves you from getting pregnant. So that is why it is dual. It saves you from STIs. It also saves you from pregnancy.
As contraception.
Exactly. So that is the dual protection of condom. So it is very, very important and very key that people should always play safe when it comes to sex. And we also try to say that, yes, no sex is safe, but the word safer sex is the word.
Okay.
Yes.
So talking about safer sex now, what are other practical ways, right, besides the condoms? What are other practical ways that people in the LGBTQI community, right, can practice safe sex or safer hygiene?
Okay, so when she said something about sterilizing the sex objects, it's very, very important. And that's also where the issue of hygiene we're talking about. You understand? If you're not a hygiene person, you wouldn't even know in the first place, okay, after sexual act, where am I supposed to? How do I store my toys? Do you understand? Some persons are so careless that, after every sex act, they just discard
dump
them.
it somewhere.
Exactly, and just move on as if nothing has happened. Then you come back probably you're late in the evening, you and your partner are there, you just grab it again, and then you just start
to rinse it.
Exactly. So it is very, very important and very key that in the absence of this, if we are using sex toys, let us always make sure that our sex toys are sterilized and we are keeping it safe and clean at all times. Because we understand that a human body is even very, very, the way our body is designed, it makes it easier for us to get infected than our male counterparts. So if we understand that, it helps us and it helps everybody to know that, okay, if I'm a lesbian, then I should be able to know how to care for my body. But again, the thing is that, and the truth is that, except I'm just speaking from what I see in the physical, but if I'm to beat my chest from what I see in the physical, I want to say that the majority of lesbians are the most cleanest persons I have seen. Yes.
Wow. Props to.
Right. Oh, yeah. That's
Thank you. Thank you so much. So I'm so glad you just said this, because I was going to ask some other questions. Okay. So talking about personal hygiene, right? Like it or not, personal hygiene plays a role, affects your sexual hygiene, right? So what are these ways that personal hygiene, like a person's personal hygiene, can affect their sexual experiences or the sexual experiences of the people that they have sex with?
Okay, so when you talk about personal hygiene and sex, it goes hand in hand. Just like my last statement. If I look at you, I'm already seeing a beautiful girl, and then I want to go down with you. And then in the process, I begin to perceive some smell that wasn't there when I came close to you on a physical aspect. And then by the time we now start going deep, I start perceiving that smell. It could be a turn off. For some persons can't stand some smell. Why for some is no deal breaker for them. You understand? But on a general, it is good that everyone understands that personal hygiene is very, very key to sex and sexual health. Because you need to keep clean. And there are some infections that you can even get from not even keeping clean.
Yeah.
When you're not on top of your hygiene, especially, again, I will say females again. If you're not very clean about your personal hygiene, there's a lot that could go wrong. There's a lot that could happen.
Yes.
So you need to, if you understand the way, as health workers, we understand the way lesbians somehow have their sex acts. So if you're not so clean, you may not please your partner. Your partner may not even want to. So it is very, very important that you understand that your personal hygiene, from your underwears, from your outerwears, from even the way you wash off. Some persons would believe that, oh, it's about me doubting myself. It's about me going to buy those so expensive fragrance. It's about me using the most expensive soap. Oh, no, it doesn't work that way. There are some persons that even in the process of using all of that, they still can't know how to. Water is everything.
Yeah.
You see water?
Yeah.
Water is everything. I used to even tell some persons, sometimes you don't even need all those other addictives, all those other extra, whatever. Just do water. If you do water and do you will see how clean you comes. If anybody is even licking you up, the person is even happy that, oh, this is so clean. And the person is licking and the person is happy.
Okay.
Yeah.
Yeah, so I think she has said something that really sticks.
Okay.
Douching is an issue, really, because people think that, okay, that's a better way to clean themselves, especially for ladies. But medically speaking, is not good because it contains some chemicals that would distort the natural flora down there. Now, that can even predispose the person douching to having these bacterial infections and fungal infections that she can transmit to her partner during sex. So it's a no. Like she said, water is the cleanser. Use water and you clean thoroughly and you'll be fine. Really.
Okay.
Yes.
So I have these conversations often with people and with women, right? And we talk about how the vagina is like the vagina is almost a dumping ground for everything that you eat and drink, right? So a lot of people, this personal hygiene and the water is not just washing, it's also drinking a lot of water because it helps balance your pH level.
Exactly.
Yes, it's also what you eat, foods that are vagina friendly. So what would you say are some of these vagina friendly actions that are not necessarily sexual, right? That just goes to help promote an all-round like good hygiene for people?
Well, I think it's just washing frequently. And then when you're menstruating, change the tampons often, change parts often. And then really keep clean. During sex, when menstruating, avoid rough sex because that can, distort a lot during sex, even cause injury to the mucosa and all. So keeping your vagina a healthy vagina is that which the person eats well, drinks well, keeps clean down there, clean undies, irons. That's something people don't know. Iron your undies it helps to kill fungi that's responsible for hair candidas. People are itching down there. That's what's responsible. So if you do that, or if one does that, it really helps keep one safe.
Okay, so yesterday was World Menstruation Day. So I'll come back to that. So when you're talking about eating right, your whole body gets to absorb that and then it goes to work where it's supposed to work. Fruits.
Yeah.
A lot of fruits. As women, take a lot of fruits, take a lot of fruits, take a lot of fruits. It helps your body. And whatever nourishes your body, nourishes it both from, especially, you know that fruit is natural. So it nourishes you from the inside and then it come out to the outside. And it goes down even onto that your vagina area. And then it just have a way of just nourishing your whole system and your whole body. So fruits, very, very key. We've talked about water. It cannot be overemphasized. Take a lot of water, even though as I'm speaking, I know I'm still not doing so well when it comes to water intake. So I'm also using this opportunity to talk to myself. But I do a lot of fruits. I could go days because I'm also I try to watch my weight a lot. So I could go days and even weeks doing only fruits. Yes.
Wow.
But water, I don't do so well when it comes to water. So but I try as much as possible to see how I can improve. And sometimes I see people commend my skin. And it's not because of what I use on my skin. It's just because of fruits. There are a lot of health benefits that comes to when you eat fruits. Like you eat it like food. It's not people that, they will come and put a plate of eba. After eating it, they will not go and take one size of pawpaw that will not.
I feel attacked.
He wouldn't do anything. He wouldn't do anything. Pawpaw is a meal. Pawpaw is a meal. If you do a whole pawpaw, it's a meal itself. You even be shocked at how full you will be, not to even contemplating going back to meal. Then talking about menstruation again, talking about also the hygiene aspect, and then you talked about people need to understand how heavy their flows are. For the fact that I can go out in the morning when I'm in my period, I already have a pad on me, and then at work, maybe I have one sanitary towel in my bag. I could want to change in the afternoon. And then as I go back in the evening, I also try to change. Sometimes I could do morning and night. But there are some people that they need to change per hour. Some persons need to change per maybe every 2 hours because they are scared they could get drenched. There are some that can wear one a whole day. There are some that even wear one a whole day and night, which is very, very wrong. But again, if we are speaking to us, we should also speak to people out there. There's a reason why World Menstruation Day happened yesterday. You go to schools and you see a situation whereby they will tell you, you try to interact with those young girls, they are telling you, I can't afford a sanitary towel. I use rag and I wash it. How well can you wash? Dr. Edith said something about ironing because of fungal infections. How many of them have iron to even iron? How many of us actually go out? How many of us hangs our underwears outside in the sun? Exactly. Most of us wash and hang inside our house where there's no presence of sun. So there's a whole lot to consider about that. So if we can also, that's why we sometimes say, oh, sex is a choice. Menses is not a choice. So we also want to see as much as possible that there's a lot of persons promoting good hygiene when it comes to menstruation, so that we are sure that people out there, young girls, young women, can have access to free sanitary towels.
That's great. That's really great. And that's like a whole other discussion in itself. Yes. So let me take us back to contraception a little bit, right? Let's talk female condoms. A lot of people have no idea how female condoms work, how effective they are, or have not even seen them. So
then we should have had a live demonstration of how to use a female condom. Or maybe we can come back some other time for that.
We would love that. We would love to have you some other time.
It's not just, when it comes to issue of condoms, actually, it's not just enough to talk about it. Because just like you said, maybe everybody have seen a penile model. Everybody have, at least, even the way the world is going now, a 15, 13-year-old girl or boy knows what a male condom looks like and can probably use it. Yes. You understand? Knows that, okay, the penis needs to be red for me to wear it. So what about her female counterpart? Just like you said, what does she know? Has she seen it before? What does it look like?
Because grown women
so it's not just enough, because no matter the demonstration I try to do now, like you get a female condom and then it has rings and then you try to twist it in the figure 8 shape, and then you need to squat. There's a particular squat that has to happen for you to be able to insert the female condom, for you to sit well, for sexual intercourse to happen. And you have to also be the one to hold it. If it's the penis that needs to come in, yes. If it's the penis, if it's the sex toy that has to come in, you have to be the one to hold it because of its make for that to happen. So like I said, it's not about it's not a talking point.
It's not a
it's
theory thing, it's a
point.
practical thing.
Yeah. So I hope that maybe subsequent times we're able to get a model of a vagina and then we get female condom and we are able to demonstrate to our audience for them to see and understand how that plays out. Thank you.
All right. So I have just 2 tiny topics we're going to touch briefly, right? So I'm wondering, what are very common misconceptions about sexual hygiene within the LGBTQI community that you might know about? Misconceptions.
Okay, so I actually wrote down something because it's a bit bulky, So we get to hear a lot really out there when we sit down with young persons and all. But there's this one that I think we should talk about. Only penetrative sex can transmit STI. We know that that's not true, really. Other forms of sex can transmit HIV and other STIs, really. Sorry, I'm talking about HIV because I'm more knowledgeable there, but I mean other routes of sex. Now, what I mean by they are other people practice oral sex, right?
Yes.
Anal sex and all. So there are other routes. So it's not just about penetrative sex that would transmit HIV. I don't know, transmit STI. I don't know if I should go deeper.
You said you wrote a list.
Yeah,
so we can touch base on all of them.
Okay, all right. Okay, then if I'm in a monogamous relationship, I don't need to practice safer sex. So because I have just one partner, I shouldn't practice safer sex. That's not true, because you're not sure about your own partner. If your partner is going out there, and if your partner does not have only you, right? Does not have only you.
You don't also know
make sure
who your
boo
partner have been with before.
Yes, exactly. So so that's something people should really look out there and know that even if you're in a monogamous relationship, you should practice safer sex. And I think we've highlighted a lot here.
Yes, we
already.
have.
Use protections, whether you're using condoms, dental dams, gloves, and then for the gay men, use a lot of lubricants. It is advocated that the gay men use twice as much lubricant as those that have heterosexual intercourse, So that's because, of course, we don't want any form of friction, and that would help to reduce injury and transmission of any STI at all. So that's something people should really know out there. And then another thing there is, I can't get pregnant, so I don't need to worry about sexual health. So for maybe advanced people in age that have passed the age of childbearing, you get, so they get to lie to themselves that I'm past the age of getting pregnant, so why should I worry about these safe sex, sexual health? Why should I worry about it? Really, just go and do whatever I want to do, whether I'm bisexual, whether I'm lesbian. No, it shouldn't be like that. You should always prioritize safe sex whenever you're having sex. Also, I can't get STI from oral sex. We know that that's not true. There is, I think there are cases where people have contracted herpes virus.
From oral sex. Yes.
And
so if you have that's what we call oral thrush. When you have oral thrush, so we usually say that the presence of sores in the mouth increases your chances, even kissing. Because we used to say that, some people will say, just like Dr. Edith said again, it looks like we're tinting more towards HIV because probably that's where we are working from. Yeah, but again, we're talking about other STIs. She has talked about herpes. There are other infections that you can actually contact through kissing. Now, we ask, can I get infected with HIV through kissing? And we say, it takes probably a bucket load of saliva exchange for that to happen. But again, there's also a clause there that says the presence of sores in the mouth increases the chances. Yes. So you may be waiting that, it will take a bucket full. After all, we just kiss for 5 minutes and we had not exchanged a bucket full.
Exactly.
But you don't know that per second that you had done, because of the presence of sores. Remember, we brush our teeth every day.
Yes.
And in the process of that brushing, some of us use what we call hard brush. So when you're doing that, you don't know that there's already presence of sores in your mouth that can also increase that chances.
Yeah.
Then again, there are body fluids exchange among lesbians. So that should not be taken for granted that, because I'm in a same-sex relationship, there's no reason why I should bother about safer sex options because I may never ever get infected and all of that. So people need to understand that safer sex is safer sex, and let's go with the options every now, every time, every day.
This is so enlightening. This is really also enlightening. So we have debunked these contraceptions. Can we talk about challenges? Right? Can we talk about peculiar challenges, like challenges that are particular to people in the LGBTQI community, right? That's narrow or just around the sexual health and personal hygiene, and
it is basically discrimination, stigmatization. So an LGBT person may want to assess sexual health, can't even present his or herself in a facility because people, they are going to judge me. If I come and I say, I'm a lesbian, if I come and say, oh, I'm an MSM, and okay, we've had situations whereby, oh, okay, because this person have this sores at the anus, and then you're like, what? Who? What? You know, that kind of a thing. So those challenges are there. But again, I need people to understand that. Let us understand that you are this person, I am this person.
Yeah.
And as health workers, it's not in your place to judge anyone. It's not in your place to stigmatize.
Exactly.
It's not in your place to discriminate. When you are in a workspace, put your religion aside. Put your values aside. Align with what the profession you're handling with is. And that's where, in some cases, some person will even, and that's why the model that probably I'm operating, the one-stop shop model is there, where, okay, we say, oh, it's a safer space for LGBT committee members. You can come in, assess medical health, do any other thing, and then, but what about the conventional facilities? Everybody, they don't have access to the one-stop shop. The conventional facilities should be able also to, and that's why I like what implementing partners are doing. So many implementing partners are working through the facilities. So they are already changing their mindsets. What it was 10 years ago is not what it is today. I can assure you that. It's still a long way to go, but we'll get there. So again, IPs need to also invest more in health workers working in those government and private facilities. Continuous engagement, sensitization, trainings. Let them understand that LGBT are humans and that they have need. And that when they have need for health, they should be able to come and say, this is what it's doing to me, this is what I want. And you don't have to look up and look down or beckon on your fellow nurse or fellow health worker to come and hear what this person is saying. Be professional at all times. If we are able to eliminate that, then the challenges that we are looking at will gradually fizzle out. So, but again, I like to say, don't be the one stigmatizing against your own self. Don't be the one discriminating against your own self. You may be working and you already think, oh, they already know who I am. But you know you don't even want to give up. So if you know you don't want to give up on who you are, be proud of who you are. Don't think that the next person is watching or that the next person is forming opinion. Even if they do, be who you are. Be proud of who you are. Move on. Do your thing. That's it.
That's like so many words of wisdom. Thank you so much.
So that summarizes the self-love. You need to love yourself. If you love yourself, then spread love around.
Thank you so much. And you just answered my very last question because I was going to ask what can be done, yes, within the medical profession, right? And like you said, a lot of people will not have access to one-stop shops, right? Especially people in like rural communities and people without access to people. There are people who don't even have access to regular so you've already answered saying, okay, the medical field is doing this educating within themselves or within yourselves within yourselves to like make health professionals more receptive and like teach how to manage situations. So thank you so much. I'm really, should I say excited? This was really exciting and enlightening and educative, and we're so glad that you could come. We hope to do this again sometime where we can talk extensively about some of the things that we did not get to talk about today. Yes. So thank you so much. I think at this point, I'd like to throw something out to our audience, right? So what exciting topics, what other important topics do you think that you would recommend we talk about next time? Or what personal experiences do you have with sex and like personal hygiene and questions that you have? Please drop something for us in the comment section. Don't forget to like, subscribe and share. Thank you.